ceria berseri 20 gigi di usia 60 nanti. Untuk kau dan aku bersama harmoni smile 5,0 membawa inspirasi, membawa inspirasi. Senyumlah selalu, ceria berseri 20 gigi di usia 60 nanti. Untuk kau dan aku bersama harmoni smile 5,0 membawa inspirasi. Senyumlah selalu, ceria berseri 20 gigi di usia 60 nanti. Untuk kau dan aku bersama harmoni smile 5,0 membawa inspirasi. Senyumlah selalu, ceria berseri 20 gigi di usia 60 nanti. Untuk kau dan aku bersama harmoni smile 5,0 membawa inspirasi, membawa inspirasi. Senyumlah selalu, ceria berseri 20 gigi di usia 60 nanti. Untuk kau dan aku bersama harmoni smile 5,0 membawa inspirasi. Senyumlah selalu, ceria berseri 20 gigi di usia 60 nanti. Untuk kau dan aku bersama harmoni smile 5,0 membawa inspirasi. Senyumlah selalu, ceria berseri 20 gigi di usia 60 nanti. Untuk kau dan aku bersama harmoni smile 5,0 membawa inspirasi, membawa inspirasi. Senyumlah selalu, ceria berseri 20 gigi di usia 60 nanti. Untuk kau dan aku bersama harmoni smile 5,0 membawa inspirasi. Senyumlah selalu, ceria berseri 20 gigi di usia 60 nanti. Untuk kau dan aku bersama harmoni smile 5,0 membawa inspirasi. Senyumlah selalu, ceria berseri 20 gigi di usia 60 nanti. Untuk kau dan aku bersama harmoni smile 5,0 membawa inspirasi, membawa inspirasi. ceria berseri 20 gigi di usia 60 nanti. Untuk kau dan aku bersama harmonis smile 5.0 membawa inspirasi. Membawa inspirasi. Senyumlah. Selamat hidup berseri. M untuk masyarakat bersama harmoni. I untuk ideal, impian di hati. L untuk lancar, senyum setiap hari. I untuk ku ekuti, kasih diberi. Senyumlah selalu, ceria berseri 20 biji di usia 60 nanti. Untuk kau dan aku.
From the young to the wise across the miles, we're building a community of healthy smiles. Knowledge and care walking hand in hand, spreading the joy across the land. So keep that smile bright and free. 20 at 64, you and me. Generations together, shining so bright. Smile 5.0, bringing the light.
Data daripada Perkeso, lebih kurang 300,000 orang warga emas masih lagi aktif mencarung. Tetapi yang kita risaukan ialah berdasarkan National Health Malaysian Survey, hanya sekitar 14.7% saja warga emas tu mencapai penuaan secara sihat. Sebab itulah melalui Smile 5.0 ni kita mahu ubah persepsi bahawa nak pastikan warga emas itu sihat bukan satu cabaran.
Betul.
Tapi mereka ni ialah aset dan boleh menjadi ejen perubahan dalam keluarga dan juga masyarakat. Dan kesihatan pergigian pun pentinglah dalam hal ni sebab macam yang Fiza cakap tadi, akan membantu warga emas makan dengan selesa, bercakap dengan yakin, tersenyum tanpa rasa malu dan aktif bersama komuniti.
Lama itu bila orang cakap panjang umur dia. Tapi in public health, kesihatan awam, kita ada pengukur lah. Maksudnya hidup you sama ada berkualiti atau hidup kita memerlukan banyak bantuan lah. Kita punya objektif nak memastikan kita fully independent lah. Yang maksudnya boleh pergi masjid, mungkin semayang tak payah pakai kerusi, tak perlu pakai tongkat. And kita faham kita kena buat aktiviti-aktiviti yang menjadikan kita kekal aktif dan sihat even the age of 60.
Walaupun kita fokus pada warga emas, tapi dia macam melibatkan semua generasi juga. Dan walaupun kita kata kesihatan mulut je, kenapa doktor berdua ni datang sibuk kat sini kan, tapi dia mempengaruhi perkara asas kita, macam tadi bercakap, makan, senyum. Lepas tu kalau sakit gigi tak boleh nak tidur,
tak boleh.
Akan lebih mempunyai risiko kepada a certain type of disease lah. So asalkan kita boleh memperkasakan para imam, para tok batin ni ke semua elderly lah. Sebab senang kalau kita bagi bagi je knowledge tu dulu, selemah-lemah knowledge tu, diorang boleh sampaikan kepada kawan-kawan. Sebab mungkin dia boleh menjawab je, sebenarnya bukan gigi tu yang memanjang, sebenarnya gusi tu yang mengundur diri.
Walaupun kita bercakap berkenaan dengan program Warga Emas, tapi kita jemput semua datang. Sebab kita nak ada elemen intergenerasi tu. Dan Warga Emas pula akan jadi contohlah dan akan bagi kongsi pengalaman kepada generasi muda. Sebab kita ada satu slot khas untuk duta-duta kita ni untuk bagi
berapa orang duta-duta?
Harapan kami lah untuk program Smile 5.0 ni dengan membawa tema Warga Emas Perkasa Inspirasi Generasi, supaya program ini menjadi satu langkah ke arah masyarakat yang lebih bersedia menghadapi negara menua ataupun kita sebut sebagai geriatric ready society. Dan sebenarnya bagi saya lah kan, end game untuk program Smile 5.0 ni ialah warga emas tu bukan sekadar hidup lama, tapi diorang hidup sihat, aktif dan dihargai. Dan kita nak juga masyarakat lihat warga emas ni bukan sebagai challenge tetapi sebagai aset dan ejen perubahan.
Di Duta Smile 5.0 Perkasa.
Untuk selama masyarakat bersama harmoni. Air untuk ideal, impian di hati, untuk lancar, senyum setiap hari. Untuk ikuti, kasih diberi. Senyumlah selalu, ceria berseri. 20 gigi di usia 60 tentu nanti.
Smile 5,0 membawa inspirasi.
60 tahun nanti.
Ya. So impak kepada perkara inilah ya. Sepatutnya negara tua ini dia bukanlah sesuatu status yang kita nak kejar.
60 tahun nanti.
Macam negara maju,
Ya.
negara berpendapatan tinggi tidak. Dia bukan macam kita nak kejar, kita nak jadi negara tidak. Macam negara adalah suatu realiti yang harus kita siapkan. Ialah bayangkan kalau kita dah capai negara tua tetapi kita tidak siapkan warga emas ni, impak yang paling besar adalah pada sistem dan fasiliti kesihatan. Bayangkan kalau kita tengok kat media sosial kan, yang popular sekarang apa? Thread kan. Kalau kita tengok lalu buat rungutan, orang hospital sesak, nak tunggu lama, nak pergi private pun tak cukup kewangan kan. So kena pergi ke kerajaan. So semua ni menjadi sesak. So bayangkan kalau kita ada peningkatan kepada warga tua dan warga tua itu tidak menua dengan sihat, maka kita akan ada satu krisis yang sangat, sekarang pun ada krisis, kita takut dia akan menjadi lebih parah lagi. So bayangkan akan menyebabkan keruntuhan kepada sistem kesihatan awam.
Senyumlah selalu, ceria berseri. 20 gigi di usia 60 nanti. Untuk kau dan aku bersama harmoni. Smile 5,0 membawa inspirasi.
Community Smile 5.0 Hormat di Sabak Bernam. So hari ini kita berada di Dewan Pusat Khidmat Masyarakat Dun Sabak untuk program Community Smile yang akan membawa pelbagai aktiviti menarik dan juga informasi kepada pengunjung lah. So apa itu Smile? So Smile adalah satu program komitmen Fakulti Pendidikan UiTM dalam membawa ilmu, kepakaran dan perkhidmatan kesihatan lebih dekat kepada masyarakat secara berterusan. So kenapa kita pilih Sabak Bernam hari ni? So statistik 2025-2026 Selangor merupakan negeri yang mencatatkan jumlah warga emas tertinggi di Malaysia. So dan specifically kepada Sabak Bernam mempunyai peratusan warga emas tertinggi dekat negeri ni mengikut nisbah warga emas berbanding jumlah penduduk daerah. So 21% ke 25% adalah warga emas.
Dalam bahasa Inggeris dia functional ability.
Hadapi oleh tuan-tuan dan puan-puan berkenaan pergigian.
Dan juga cara memberus gigi dengan cara yang betul. Jadi hari ini nanti cikgu akan pegang ni gigi.
Dan kita boleh gaulkan dia, tapi sebelum tu saya letak sikit parutan limau nipis. Dia punya biji, dia punya kulit dia je.
Okay. Dan di sini juga ada simulasi survey. Kami akan tanya beberapa soalan berkaitan dengan risiko jatuh lah. Lepas tu yang satu lagi terrorism, kami panggil selaput luar lah. Selaput luar.
Banyak komponen. First day ialah BMI. BMI ni kita nak tengok lah.
Memperkasakan kesihatan komuniti.
Kita rasa seronok, banggalah boleh dapat sertai sekali dengan ni kan. Tentu dekat kawasan kita boleh ada macam ni, alhamdulillah lah. Happy lah dengan program-program ni kan.
Bagi saya memang sangat menyeronokkan lah, segala input-input yang diberikan sangat memberangsangkan.
Dah tengah-tengah program ni nampaknya dah crowd ramai datang ya, penuh dewan tu. Meriah lah, nampak memang meriah dan sambutan cukup baik lah. Saya harap lah program seperti ni untuk kawasan-kawasan luar bandar macam Sabak Bernam ni cukup bagus lah. Ya, sekurang-kurangnya fokus kepada warga emas terutamanya, banyak yang hadir dan dapat maklumat-maklumat walaupun gigi kita ni kadang-kadang setengah perhatian tak berapa ambil kisah. Kalau dah pakai gigi palsu dah kira dah okey. Tapi sebenarnya banyak dari segi penjagaan dan penambahan baikan ya untuk keselesaan lah kesedaran hidup. Bila gigi sehat, alhamdulillah semuanya akan berjalan lancar.
So kalau kita nampak sepanjang live hari ini memang sambutan sangat menggalakkan daripada warga emas khususnya. So warga emas di Sabak ni kita boleh katakan sangat aktif dan cergas lah. Mereka memang terlibat dalam aktiviti memasak, aktiviti karaoke pun ada. So kita akan bersiaran seterusnya. Okey.
untuk masyarakat bersama harmoni. I untuk ideal, impian di hati, L untuk lancar, senyum setiap hari. I untuk ikuti, kasih diberi. Senyumlah selalu, ceria berseri. 20 gigi di usia 60 tentu nanti. Untuk kau dan aku bersama harmoni.
Welcome to the Faculty of Dentistry, University Technology Mara, where innovation meets compassionate care. Our mission is to nurture future-ready dental professionals through world-class education, cutting-edge facilities, and a culture of lifelong learning. Hands-on clinical training begins early, ensuring our students gain the skills and confidence to deliver excellent patient care and serve communities across Malaysia and beyond. We lead research in oral health sciences, embracing technology and innovation to advance dental medicine and improve quality of life. With global partnerships and award-winning academics, UiTM Dentistry stands at the forefront of dental education in the region. We are proud to introduce our Dean and our Deputy Deans, whose vision and dedication continue to shape the future of dental education. Join us in shaping the future of oral healthcare. Faculty of Dentistry, University Technology Mara, carving the future leaders of dentistry.
Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. A very good morning. Salam Malaysia Madani and salam UiTM di hatiku. Welcome back to day 2 of the Smile 5.0 webinar and podcast series, proudly organized by the Doctor of Dental Public Health Program, Faculty of Dentistry, UiTM. As Malaysia transitions toward an aging nation by 2030, this year's theme, Empower Other Adults, Inspiring Generations, aligns with our commitment to healthy aging and the Ministry of Health 2060 aspiration. Throughout this week, we are bringing together top experts from academia, healthcare, and government agencies to explore multidisciplinary strategies for healthy aging. Without further ado, welcome to our second webinar entitled The Policy Roadmap, Crafting the National Policy Roadmap for a Healthy Aging. We encourage everyone to stay active in the chat. If you have any questions for our panelists, please drop them in the YouTube live chat and we will address them during the Q&A sessions. It's now my pleasure to hand over the session to our moderator for today, Dr. Muhammad Arif Alwan Khalid. But before we begin, let us sit back and enjoy the Smile 5.0 video teaser. Hi everyone, join us for webinar 2, the policy roadmap, crafting the national policy roadmap for healthy aging. Wondering why this topic matters? Let's hear from our head of department, Dr. Nawal.
Assalamualaikum and hello everyone. So why webinar 2 is important?
Malaysia is becoming an aging nation and it's going to impact everything from our economy, housing to healthcare and even our own family dynamics. So I highly encourage you to join this webinar featuring panel of experts where they will explore policy gaps, the silver and care economy and the actions we need to take so our seniors can age independently with a better quality of life. So don't miss out and see you there.
Hi everyone, I'm your moderator for the upcoming webinar talk, and I'm not alone. I'm going to bring you an expert to talk about this. First, we have Ilyana Mukhriz from Khazanah Research Institute. We have Mr. Chai Senting from My Aging, and we have Dr. Mustafa Jaafar, Deputy Director of Health for the Oral Health Division. Please subscribe to our YouTube channel, Smile UiTM 450, and wait for our live session. Stay tuned.
Assalamualaikum and a very good morning to our respected panelists, distinguished guests, colleagues and participants. Welcome to webinar 2 of our Smile webinar series 2026. Today, we will discuss a very important and timely topic, the policy roadmap, crafting the national policy roadmap for healthy aging. Malaysia is moving steadily through population aging and is projected to reach age nation status by 2048. This demographic transition will influence not only health services, but also welfare, finance, housing, transport, education, employment, family structures, and community life. Malaysia already has several policy directions related to aging, including, first, we have Dasar Warga Emas Negara, the National Aging Blueprint 2025-2045, Plan Tindakan Warga Emas Negara 2026-2030, the Ministry of Health Elderly Healthcare Services Action Plan 2023-2030, and the Dementia Action Plan. The key question now is how these policies can be translated into integrated, sustainable, and community-based services for older adults and their caregivers. In this session, in this webinar too, we are honored to have 3 panelists who will guide us from different perspectives. We have Mr. Chai Senting from the My Aging Institute. We have Puan Ilyana Syafiqah Mukhriz Mudaris from Khazanah Research Institute. And we have Dr. Mustafa bin Jaafar, Timbalan Pengarah Kesihatan Negeri Pergigian, Wilayah Persekutuan Kuala Lumpur and Putrajaya. Together, they will help us understand aging policy readiness, the selfie economy, the care economy, healthy aging, and the role of oral health within older adult care. I would like to invite everyone to actively participate by sharing your question in chat. Let us use this forum to understand the policy landscape, identify current gaps, and explore political solutions that supports aging with dignity, independence, well-being. Before we start, let me introduce you to our panelists today. First, I would like to start with our third panelist first. We are going to start with our third panel, which is Dr. Mustafa bin Jaafar. He is the Timbalan Pengarah Kesihatan Negeri Pergigian at the Jabatan Kesihatan Wilayah Persekutuan Kuala Lumpur and Putrajaya, Ministry of Health Malaysia. He is a dental public specialist and extensive experience at both ministry and state levels, including previous service at the Office of the Senior Director of Oral Health MOH. His work spans oral health policy and planning, public health advocacy, clinical and dental care research, community programs, and oversight of public dental facilities and service delivery. Thank you, Dr. Mus, for joining us today. Instead, you're busy work. Thank you. Yes, thank you. Next, we are going to introduce you to our second panelist, Puan Ilyana Syafiqah Mukhriz Mudaris. She's a research associate at Khazanah Research Institute. Her research interests center on public health and Malaysia's care landscape. She holds a master's degree in Transnational Neuroscience from Imperial College London and a Bachelor of Science in Biomedical Science from the University of Sheffield. Before joining Khazanah Research Institute, she worked in the Transformational Healthcare Unit at Frost & Sullivan, bringing experience in healthcare analysis and consulting to her current work on care policy and the care economy. Thank you, Ilyana, for joining us today.
Thank you for having me.
Next, we are going to move to our first panel, Mr. Chai Sengting. He's a research officer. She's a research officer at the Malaysian Research Institute on Aging, My Aging, University Putra, Malaysia, a senior researcher in social gerontology. He has extensive multidisciplinary experience in population aging, active and productive aging, lifelong learning, social protection, long-term care, age-friendly communities, and the socio-economic dimension of elder care. He has contributed to national and international aging initiatives involving UNFPA, WHO, UNDP, the World Bank, and Malaysian government agencies. Notably, he served as a co-consultant supporting the National Aging Blueprint Study and has published on aging policy, aged care, and the needs of the older Malaysians. Thank you, Mr. Chai, for joining us today.
Morning.
Yeah. Okay. All right, let's start with our first round. And the first question will be on Mr. Chai. To begin our discussion, I would like to start with the broader national policy landscape. Before we explore the economic, care, and oral health dimensions, it's important for us to understand whether Malaysia's current aging policy framework is strong enough to prepare us for the demographic changes ahead. Malaysia has several aging-related policy and plans, including National Aging Blueprint 2025-2045. For an aging research and policy perspective, are these policies sufficient to prepare Malaysia for aged nation status by 2048, and how do they help the country respond to this demographic transition?
Thank you. Maybe as a preamble, I would like to make use of my first slide, which is actually just to provide a bit of a background to the audience and also to my fellow forum panelists. None of the policies that we have developed in Malaysia started in vacuum. A lot of it actually goes all the way back to 1991 when the United Nations introduced the principles for older persons. And the first World Assembly on Aging was actually held in Vienna in 1982. And I think Malaysia participated. And that was when, there is a global consensus to actually use 60 years old as the cutoff point. Of course, many countries, WHO themselves included, use 65. But this is just a definition, a cutoff for convenience sake, for policy making. And in recent years, the next most important milestone at the international level is the Second World Assembly on Aging in 2002, where there is a Madrid International Plan of Action on Aging. Of course, there is supposed to be one in the Third World Assembly, but as you all know, because of COVID, that did not really materialize. But SDGs came. Before SDG, we have the Millennium Development Goals. And SDG is more responsive because it contains several indicators and targets for older persons. But what we are at now today is actually in the UN Decade of Healthy Aging. I'm sure this has been touched. It has been around since 2021. It was actually started by WHO. There are 4 priority areas and 4 action areas. And it's really related quite a bit to the original age-friendly cities and communities idea that was previously introduced in 2007. Next graphics. So Malaysia's first national policy on older persons, not aging, but on older persons, started in 1995. And in 1997, the ministry also started what we call a National Advisory and Consultative Council for the elderly, and today is for older persons. It contains several subcommittees where various ministries led jawatan kuasa kecil on health, on housing, education, environment, and recreation. Of course, the key ministry and their department that is responsible is Jabatan Kebajikan Masyarakat. And the new national policy for older persons was introduced in 2011, and the Ministry of Health also introduced its own national health policy for older persons. And the Ministry of Housing and Local Government has this physical planning guideline for the elderly. This will have important ramifications on long-term care service providers. But in between, there are plenty of other documents before care economy is recognized as a core area of policy trust, including we have variously Bahagian Pembangunan Kesihatan Keluarga has published various guidelines and guidebooks on how to care for the elderly. There has also been oral health guidelines being published, Meals on Wheels. So we also have related laws that governs lifetime pension coverage under the civil service, under SOCSO, under EPF, and also governing care center acts. Next slide. But in recent years, I think under the 13th Malaysia Plan, it was spelled out specifically that we have to prepare for aged nation, and care economy was highlighted. That was the first thing. Long-term care was highlighted for the first time. And there was also a mention of trying to reform our pension system, especially the private sector. So in recent years, the two ministries did not come up with a new national policy on older person, but they updated the plan of action for these two policies. And it was actually largely in response to what happened during COVID-19. Late last year, the Ministry of Women launched a strategic framework for care, and that's actually on childcare, aged care, and disabled person care. But what's under development today is the Ministry of Economy is working on a national aging blueprint. It's not published yet. It was referenced in the 13th Malaysia Plan, but it will be presented as a white paper to the Parliament first. The Ministry of Women is working on an older person bill or senior citizen bill. We do not exactly know what the focus will be on, but it is most likely under the protection of older persons or elder abuse. And the Ministry of Housing and Local Government is updating its guideline for physical planning of older persons. So 802 is still not enforced, for those who are asking about the Private Aged Healthcare Facilities and Services Act. So that more or less sums up the policy situation that we are at. I think just as a closing remark, I do not think Malaysia is short of any policy documents. But as we all know, a policy document or the National Development Plan is actually a roadmap of actions. And it does not mean that action has been taken. It just means that this is the direction that the government is currently planning to work on. And it will require a lot of coordination and support, including mindset change from the public for many of these things to happen. Thank you. Doctor, your mic is not on.
Okay. Thank you, Mr. Chai. That gives us a very helpful overview of Malaysia's current policy directions and the importance of preparing early for population aging. From your sharing, we can see that our Malaysian have a very good policies and blueprints. But the next question is whether these policies are able to address the practical and economic realities faced by all the adults, families, and caregivers. This brings us to the policy and economics perspective. The next question will be on Ilyana. From a policy and economic perspective, what are the major gaps in Malaysia's current aging policy ecosystem, especially in financing long-term care, social protection, and care services?
Yeah, so apologies that I don't have any slides, but for those who are interested to find out more, you can find our past work on the Khazanah Research Institute website. And I think I agree with Mr. Chai. We are not facing a lack of policy documents, but maybe issues with follow through and commitment. So our the first area or policy gap is the financing and long-term care. So Malaysia does not have a dedicated financing for long-term care, unlike in countries such as Japan and Singapore. Our healthcare is tax funded and supplemented by out-of-pocket or private insurance, but care for elderly needs to be paid for through household finances or is absorbed by the household through unpaid care work. The current policy landscape is focused on encouraging aging in place. So the government is expanding social support services such as daycare centers and at-home services. But this means that the long-term care landscape, which refers to care homes or nursing homes in Malaysia, is highly privatized, which introduces the issue of affordability, and there's also quality issues. When formal care services are expensive, many families, especially those in the lower income groups, will continue to rely on unpaid care. And care infrastructure is also mostly concentrated in urban centers, which means that there is a rural-urban disconnect. Another policy gap that I would like to highlight is the issue of social protection, where many Malaysians are retiring with insufficient savings, particularly workers with interrupted employment, informal workers, and women who spend time outside paid employment. And existing social assistance programs are often narrowly targeted, temporary, and fragmented across agencies. Another issue that we have highlighted in the past is of care workforce insufficiency. So low wages, limited career pathways, and intensive work conditions have resulted in high turnover rates among care workers. And there is also a lack of proper training and certification, both for paid and unpaid caregivers. On a large scale, there's a reliance on NGOs or small organizations to deliver such trainings. And I think the final policy gap or issue that is faced is that care oversight is concentrated under the Ministry of Women, Family and Community Development. This has led to care being stigmatized as primarily a women and welfare issue, when in reality it's a cross-cutting concern that affects areas such as workforce development, productivity, and labor protection. Additionally, multiple agencies oversee different components of care based on their respective mandates, which results in a fragmented governance. And while frameworks exist for regulating formal care services, significant gaps exist in coordinating across sectors, particularly in integrating informal care into the national policy agenda. So this disjointed governance structure limits the effectiveness of care services, particularly in addressing the diverse care needs of the recipients across different life stages. So briefly, these are some of the things that are considered still gaps in the landscape, but we can dive in deeper in subsequent questions.
Thank you, Dr. Puan Ilyana. Okay, thank you, Ms. Puan Ilyana. That was a very important point, especially on the need to look at financing, long-term care, social protection, and support system. Aging clearly affects not only individuals, but also households, caregivers, and the wider economy. So when we talk about healthy aging and care, one area that is sometimes not highlighted enough is the oral health. Yet oral health is closely linked to nutrition, communication, dignity, social participation, and quality of life. I would now like to bring in the oral health perspectives. So my next questions will be on Dr. Mustafa. Okay.
Yes.
When we talk about healthy aging, oral health is often overlooked. In the current aging policy and elderly healthcare plans, where does oral health fit in, and is it given enough attention?
Thank you very much, Dr. Muhammad Arif, for the question. I'd like to bring your attention, everyone's attention, how important it is in terms of oral health as defined by WHO. WHO defines it clearly that oral health is a state of mouth, teeth, and orofacial structures that enable individuals to perform essential functions such as eating, breathing, and speaking, and encompass psychosocial dimensions such as self-confidence, well-being, the ability to socialize, work without pain, discomfort, and embarrassment. So oral health actually varies over life course from early life to old age, and it is integral to general health and supports individual in participating in social and achieving their potential. It is very clear here, WHO defines it in terms of the structure, it has to be complete. You know, if it is not complete, then it gives some problem for everyone to, especially the elderly, for example, to do their daily activities such as eating. For example, if they want to recite Al-Quran, it's going to be difficult with the slurry speech, you know, and sometimes they tend to avoid meeting people because of having tooth loss, several teeth that is lost. Yeah. that are lost. So it's very important. This is also psychosocial dimension. When we notice, embarrassment or feel shy to mingle around because of oral health is incomplete, then there's an indication that there is a dental problem there, oral diseases problem. Yeah. So we need to really see it as a whole. Not only the structure is enough, but also psychosocial dimension. And if we do not tackle it, it will definitely affect their quality of life terribly. Yeah, I've seen, for example, an elderly who lost their dentures. For example, the person was not able to eat well and had a significant loss of weight. Just simply because loss of her denture last time. Yeah, so it's very important to make sure that as defined by WHO, that we need to have a full set of teeth and and is natural and can function well. Yeah. So the thing that you asked just now regarding the in terms of oral health, I noticed that another thing I want to highlight is that how does it relate between oral health and general health is because of oral diseases and conditions also share risk factors that is common to leading non-communicable diseases, including all forms of, for example, tobacco use. If you consume tobacco or vape, for example, not only you suffer from risk of having lung cancer, but you can also it can also affect their gums, worsen their gums, stained teeth, anesthetic, and can cause a lot of problem there. Alcohol use, for example, tobacco and alcohol, and also betel nut chewing, for example, can give a synergistic effect and a risk of having oral cancer. In terms of if someone consume too much sugar, for example, can not only cause diabetes, but also can cause dental caries, obesity, and also can cause periodontal problem or gum disease. And so if you don't improve your gum disease, you can also worsen the blood sugar level, and so it has bidirectional relationship. So it's very important that we need to take a good care of oral health because it affects the general health as well. So another thing that I want to highlight, you asked again regarding is it given enough attention and where does oral health fit in? If you have a look at we have a look at the elderly healthcare action plan, quite a number of effort has been done there, is being reflected in the action plan, whereby there is some effort in terms of strengthening healthcare program, to expand oral healthcare in primary healthcare, and also to increase periodontal screening. This is very good because to make sure that we can do early detection by doing periodontal or gum screening. So if we can screen them early, then we can detect early, then we can do intervention or prevention, so that because if you have a gum problem, that means the supporting structure around the teeth is weakened or problematic, and because of bacteria attacks and things like that, and can cause tooth loss significantly. So if we do that as a screening, we can detect early and help to maintain sound teeth, and also gum health. So this is very important. In the action plan is mentioned clearly, so that we need to integrate, so that the primary healthcare is multidisciplinary. We have oral health apart from other healthcare services for the elderly. Apart from that, the framework also highlighted oral health as part of the multidisciplinary, as I mentioned, in primary healthcare. Interventions such as we can do interventions, for example, at the institution or care center, home visits, for example, domiciliary oral healthcare services, along with the community nurses, and some outreach activities also have some potentials where we can meet up the elderly through the Kampung Angkat program or program Perumahan Rakyat. And also, apart from that, they have another access from the hospital, whereby we have specific special care dentists, dental specialists. And also we work close hand in hand with them to provide care. For example, there's a specific hospital in Kuala Lumpur, hospital rehabilitasi ceras, and also geriatric department in the hospital, where we can specifically look into the elderly and provide care to them. And also it is very integrated between all these interventions, whereby we make sure that at community level, the primary care and the secondary care is integrated. Apart from that, the action plan also looks into to expand the community nurses' role and also dental therapists at the community level, and so that we can provide healthcare services for the elderly at community level holistically. Another thing is in terms of human resource, we are looking into planning to ensure that knowledge of our staff and can also provide services that are efficient, for the elderly. Yeah, so there are quite a number of things as been done to make sure that our team can respond to the needs of the elderly population. Thank you.
Dr. Mus, I have an extended question for you.
Yes,
Do we
sure.
have a compulsory oral health examination for the warga emas? Because I think warga emas they have a orange book for them, right? So
Yes.
they need to have the compulsory oral health examination for them now?
Yes. Okay. For your information, whoever that utilize the dental care services, it is compulsory for us to do dental screening. Yeah, including periodontal screening and also normal oral health status and conditions. This is to make sure that we have a proper record of the elderly. There are several functions. Not only we know the oral health status, and also in case for forensic cases, among others. So for reference, to make sure that the dental records is complete, we have one patient, one record policy, whereby everybody should have their record with the Ministry of Health or within a private sector, so that at least if anything happens, we can provide care that is required by the population, and also for references, for referral, and also to integrate care for research with the consent, of course, and for forensic cases reference. And so it is compulsory as they enter the service, but we are promoting more people to provide to seek dental care and have a dental checkup at our dental clinic, so that we can identify early in terms of their oral health status. At the moment, according to the data, Ministry of Health, we have this coverage is around 9.4% according to 2025 report. Yeah, so we hope that more will have annual dental checkup. Yeah, we have this tagline, ingat hari jadi, ingat doktor gigi. So that at the moment, only about a quarter of Malaysians only come for dental checkup, annual dental checkup. So we hope that more will turn up and ingat hari jadi, ingat doktor gigi. Please come so that we can help. Even though you do not have any problem, just come to us. We can. It's very important before you have dental problems, because once you have dental problem, usually in most cases it is serious. And also studies have shown that quite a number of our respondents last time under National Oral Health Survey thought that their oral health status are quite good. But actually, when we check, unfortunately, it says otherwise. About half at least are not that require treatment and some form of treatment. So it is better to come, even though you are well, you think you are well, you have no dental problem. Don't wait until the time bomb explodes. Come to dental checkup, to dental clinic for dental checkup. In case if you have any problem, we are more than happy to help you. Thank you.
Thank you, Dr. Mus.
My pleasure.
Okay, thank you, Dr. Mus. All right. That reminds us that healthy aging should not be seen as nori as simply treating disease, but as maintaining function, dignity, and quality of life. At the same time, aging should not only be framed as a burden. The National Aging Blueprint also introduces the idea that an aging population can create new opportunities for society and the economy. This leads us to the concept of the silver economy. The National Aging Blueprint highlights the silver economy. Could you explain this question for Mr. Chai. Could you explain what the silver economy means and how Malaysia can turn population aging from a burden into an opportunity?
Thank you, Doctor. Maybe I could have slide number 7, please. I think it is very useful for us to talk about why do we need policy changes or evolution or And people sometimes, it's very hard to convince them change is necessary. And to me, bagi saya, the issue here is the public tends to have an inertia towards change. And when they see demographic changes, structural changes to the society, it's very hard for them to imagine how it will impact the system. And we have experimented with a few ways to try and explain this phenomena. And one of the best things I can think of is, it's like asking a fish, whether do you know that you are swimming in a tank of water? It's in our environment. The system situation is a little bit like what's happening. We have always tell people about the statistics of older persons, right? 11%, 1 out of 10 is an older person, 60 and above, 8% is 65 and above. But what it doesn't register for many people, and I have some statistics that we could talk about later, is how will this really change our society? We had a booming economy in the 80s and 90s, partially because we have a huge surplus of young people entering the workforce, and fertility rates are falling, and then the percentage of the working population has increased. We call that the first demographic dividend or the population bonus. But we are now closing, that window or demographic bonus is closing because although fertility rate remains low, it has dropped below replacement level, and slowly we can see the percentage of older persons increasing. So usually when we talk on a population aging basis, we explain to people that the second demographic dividend is something we have to work and plan for. It doesn't come automatically. So as fertility rates plunge, every family and household have 2 children or less, and people not getting married. What we needed to do is the surplus that we get from the first demographic bonus have to be invested in structures. And Malaysia is luckier than most sebab kita ada KWSP, we also have QAP. So we have already set aside the current bonus and the funds into some kind of a pension structure. But it is not automatic. That is why you are seeing insurance structures coming out. We have been talking about a national health insurance for decades. People keep thinking that, oh, why should we do this? Why should we do that? But tuan-tuan dan puan-puan, you have to remember that in the past, we also don't have public education system. We also don't have public healthcare system. So all these have to be invested and developed. So we also develop a pension system. Of course, it's not perfect. But now we need to talk about long-term care structures, or else it will be exactly like what our colleague from KRI is saying. It's all out of pocket. You're paying it out of pocket. So if you can afford it, good. But if you can't afford it, there's no other ways to make sure that the service is delivered. And our public healthcare system does not technically provide public long-term care. All long-term care mostly are provided by the charitable or the private sector. So this is where the third structure comes in when you are asking me about what is the definition of the silver economy. Now, the silver economy, or I prefer to use the term longevity economy, is that when you have a bigger portion of older persons in your population, then we cannot imagine automatically or assume automatically that they are going to be dependent or whatsoever. That's going to fuel the care economy. Warga emas hidup umur lebih panjang, they live longer, they will need care services and all that. But who's going to pay for it? And whether this silver economy will support new jobs, will support new industries, all that will really depend on the consumption level and the services level. But the silver economy also highlights one particular contribution. Maksudnya, is there a way we can see how older persons can work longer? They can remain in the workforce longer and continue to generate economic value. So this is very capitalist approach to the whole thing. But the idea here is that, if your life expectancy, has increased from 60 plus to 75 to even 80s in the future, is it really worthwhile to imagine that, working 1/3 of your life is going to cover, the last stage of another 20, 30 years in retirement? So what the silver economy suggests is that it's not just older persons as consumers, after the age of 60, but also older persons as workers, as role players, whether they are taking care of children, whether they are taking care of grandchildren, whether they are doing other voluntary work, or whether they are in a paid role. All these will contribute to what we call a silver economy. And it is a multi-billion-dollar industry just from consumption alone. So this is why we talk about the third demographic dividend, is when we figure out ways as successive cohorts of older persons are healthier, are more highly functional, more educated and wealthier, then they will be able to bring in a second or a third demographic dividend through the actions of the older population themselves. So we must have policies that enable their participation. We are not forcing everyone to work till they die, but we must have a way to make sure that those who want to continue and remain gainfully employed, there's a way we can phase them out of retirement and not jump off a cliff. You go to your 60th birthday and you don't wake up the next day a totally different person. So this is what we are trying to encourage and trying to see whether this could be reflected in our policies approach dan pendekatan program kami di Malaysia. Thank you.
Thank you, Mr. Chai. That was a very interesting explanation, because from your infographic that you share with us, it reminds us that demographic dividend doesn't stop with the silver economy. While the silver economy focuses on the opportunities created by an aging population, achieving those opportunities depends on having the right support system in place. One of the most important is the care economy. So I'd like to bring Ms. Ilyana into our discussions. Behind every aging society, there's a large amount of care work, whether paid or unpaid, formal or informal. This connects directly to what Khazanah Institute works on the care economy. I think the article is written by you, right? So Khazanah Institute has discussed the care economy in relation to aging and family care. Could you explain what the care economy means and why it's important for Malaysia's aging future?
Yeah. So basically, the care economy refers to all forms of paid and unpaid care work. So this includes all segments of society that contribute to the provision of care and can range from the state, market, families, and community. And when we refer to care, we can talk about childcare, elderly care, or care for those with disabilities. So the care economy consists of paid care work and unpaid care work. And when we talk about paid care work, we are referring to the provision of physical, emotional, psychological, and developmental support to a care recipient performed for pay or for profit. So examples of those who provide paid care work can be nurses and or early childhood educators or TASCA teachers. But on the other hand, there is unpaid care work, which refers to the same type of care, but it does not receive any financial compensation. And this unpaid care work can be delivered by family members or volunteers who are typically motivated by personal relationships and emotional connections. Examples of unpaid care are what we see from spousal caregivers, so those who are elderly, who are taking care of their husband or wife who is perhaps less able, and the sandwich generation, where adults currently care for both their parents and their children. And we can also take an example of special needs parents who care for their child based on their disability. So why is understanding the care economy and how it operates, as well as how we can make it more sustainable, an important thing? It's because Malaysia is facing a growing demand for long-term care, I think, as highlighted by Mr. Chai just now. As people live longer, they are facing more chronic diseases, frailty, and mental impairments. There's an increasing need for long-term care. And historically, our care model depends on unpaid care on families, particularly women. However, our smaller family sizes, higher female labor force participation rate, and urbanization means that many elderly are left unsupported, or care work is resulting in burden on unpaid caregivers. Unpaid care affects economic productivity among those with working age and can result in elder abuse. And these are just some of the arguments towards making sure we have a robust care system in place to meet the needs of the nation. And investments in the care economy will actually ensure economic productivity of the working age population, while also balancing ensuring that the elderly age with dignity. So yeah, thank you.
Thank you, Ilyana. I will have extended question for you because yesterday our webinar one, we discussed about the Parental Care Act. Do you think this Parental Care Act will be helpful in this situation? Because yesterday, Chair Azrul and Dr. Syed Arjunet mentioned that the Parental Care Act must make the situation burden the care because the budget for care is increasing. So this Parental Care Act may give punishments to them as a care. So what is your opinion regarding this Parental Care Act?
Yeah, it's hard to make like very decisive conclusions because we don't really know what is exactly the contents of the act, right? But we know vaguely sort of what they would like to include, and there are examples of parental care acts in other countries. But I think what is important, if we want to put this in place to make sure that the family is responsible for the elderly, is to make sure that the family has a choice and that the family has support. So these two things are actually the responsibility of the government. So in Malaysia, filial piety, so taking care of your parents, is something that is culturally in place, right? And it's something that all families would like to do, but it's increasingly becoming unsustainable because of things like living cost pressures, stagnating wages. So you have to pay for your parent as well as and care for your parent as well as your children. So the government can place responsibility on the family, but only if it has also invested in things like home-based care, daycare centers, respite care, training, and so on. So the care system or the care infrastructure also has to be there to support the caregiver, because we cannot just say you have to take care of your parent but not provide other means for them to take a break or for them to, learn how to properly care for their parent. So in the UK, for example, if you are a caregiver for someone with Alzheimer's, there is like a highly structured support. So you have like a carers assessment by a local council. You can explore respite options, and you can secure allowances if you are providing like a certain number of hours of care per week. So these things need to be in place in order for us to mandate sort of care, because if without these things, then it opens up the room for elder abuse, because the child is forced to take on the care while also balancing other things, including work.
Thank you. Maybe Mr. Chai have something to add on regarding this question?
Yes, I would like to echo what Ilyana has said, but I would like to, play the devil's advocate and try and ask everyone, especially from the audience, to try and remember that it's not going to help to pass a law to try and force adult children, to take care of their parents, right? What we do need, is actually laws on elder abuse, neglect, and maltreatment to provide protection for older persons, whether they are living at home or whether they are living in care centers. That's what we really, really need. But our culture and our society tends to fall back on this filial piety approach. Not that there's something wrong with it. I think the Sharia law made provisions for tuntutan nafkah is actually already available in the existing state structures in the Sharia courts. But my main issue and concern is that if a family has to go to court or seek, remediation or remedial action through legal recourse, then there's really very little familial kinship or relationship left that we are trying to obligate someone to take care of another. That's just a recipe for further abuse, when you're trying to force people to live together. But there's one point we can make from all this, and that is to try and remember that when we have this so-called Parental Maintenance Act or Older Persons Act, the primary focus is on protection. And as Ilyana says, if you are not providing support for families, you are just introducing more hurdles. And when you make comments like we should punish or fine adult children who send their parents to care homes, then you are taking the entire aged care industry wrong. You don't say, I'm going to fine parents if they send their babies or children to Taska or Tadika or Taman Asuhan Kanak-Kanak. You are just relaying the wrong information. I know our culture, we don't like to, speak up and all that, but it is getting to a ridiculous point where, interactions in the parliament, where a parliamentarian can ask a deputy minister specifically, is your law going to contain punishment for adult children who make use of these services? We are not talking about abandonment in charitable homes. We are talking about, adult children paying for care, paying for services for industry. And you are talking about lumping all of them together as a form of abandonment. So I think it's highly irresponsible. And for someone who have worked in the research area on aged care, it pains me to say that this is the kind of attitude that has hindered the growth of the long-term care industry, of the aged care industry. And this is a stigma that we need to address publicly and end this. It is culturally acceptable for Pondok Warga Emas, but Pondok Warga Emas doesn't provide care. We have so many gaps in the current regulations on care of older persons. We are not talking about that, and then we go and fall back on filial piety issues. I think this has been, the first day I started work until today, this has been a recurring theme in the field. And unfortunately, the public and the policymakers and the powers to be are still not getting it. Thank you.
Thank you, Mr. Shah and Puan Ilyana. That's a very important reminder that care should not be treated as an invisible family responsible loan, but as part of the country's social and economic infrastructures. If we connect this back to health, one practical way to support healthy aging is by preserving function. The next question will be on to Dr. Mustafa. In oral health, functional ability includes being able to chew, speak, smile, and participate socially. This brings us to campaign 60-20. I think you have mentioned it before, right? But the Ministry of Health promotes campaign 60-20, which encourages Malaysians to retain at least 20 naturalities at the age of 60. How can this campaign support healthy aging, and why is maintaining functional naturalities important as people grow older?
Thank you, Dr. Arif, for asking me this question. Very interesting question. I'd like to answer the second question first. Why is it so important? At the moment, I'd like to inform you in terms of tooth loss. At the moment, for elderly age 60 and above, there are about 34.3% of Malaysians elderly having more, 60 old and above, about 34.3% only, about 1/3 of our population have 20 teeth or more. Yeah. So another 2/3, meaning another 2/3 are having less than 20 teeth. That's the target of according to the National Oral Health Strategic Plan is for the country by the year 2030 is to have, we hope to reach up to 50% of our elderly to have more than 20 teeth or more. Yeah. So we need to do a lot of interventions, a lot of approach to make sure that more elderly, when they reach 60 years and above, they have at least 20 teeth, about half of our population by the year 2030. Yeah, so that's the target. So why is it so important to have 20 teeth? According to the recommendation to preserve at least 20 teeth stems from a global initiative originally proposed by the WHO and heavily championed by the 80-20 campaign in Japan. In Japan, while in Malaysia we have 60-20, in Japan they have 80-20. If you check at the age of 60, 20, the data shows that they have around 70% of the population have at least 20 teeth. Yeah, for when they reach 80, about 50% of their population are having at least 20 teeth, roughly around that figure. Yeah, so meaning to say that we have a long way to go. We still need to do more so that we can preserve our teeth as many as possible. As we all know, we have a maximum of 32 teeth. Yeah. However, dental research have shown that it's not. Maybe you can still, survive if you have at least 20 natural teeth. Meaning to have meaning to say that you have at least about 10 functional and original teeth, opposing pairs, meaning upper 10 teeth and lower 10 teeth. It's very important, because this, if not, the dental bite will be shortened, too short, and we cannot really masticate or chew the food very well. So why is it so important? Because to make sure that it is functional and can really process or masticate the food very well. Another thing is also there is some problem. If you have lower than 20 teeth, the ability to chew hard fibrous food drops significantly. So it will become very difficult for the elderly later to eat hard food, such as vegetables, fresh vegetables like apples, and lean meats, protein, even as simple as dodol, also difficult to eat. All this hard food, chewy food can be very difficult for them to eat. So they can only eat simple food like soft food, like processed food, carbohydrate, heavy foods. That means it will definitely affect their nutritional status, whereby they cannot eat balanced diet. So it is very important that we need to maintain 20 teeth and above so that we can enjoy eating healthy diet, all kinds of food, vegetables, and fruits, so that to get all the nutrients. So if not, then it will cause to protein, energy malnutrition, and also weight loss and physical frailty. It's very important to make sure that they can maintain 20 teeth and above so that it will not affect their physical health or general health. Another thing is also epidemiological studies have revealed a strong correlation between tooth loss and cognitive decline. The mechanical action on chewing stimulates cerebral blood flow and activates regions of the brain responsible for memory and learning. So older adults with fewer 20 teeth face a significantly higher risk of developing cognitive impairment of Alzheimer's disease. Very interesting, isn't it? Compared to those who preserve their teeth. So we need to make sure that we avoid having lesser teeth, because it can also, there's some studies that associated it with cognitive impairment and Alzheimer's disease. Second, another one is if you have fewer than 20 teeth, it can lead to slurred speech, changes in facial aesthetics such as sunken cheeks, and decreased social confidence, like I mentioned earlier, in terms of psychosocial effect. So it is very important because just now you mentioned about silver economy, if they need to work, how can they work well also, because if their appearance is not well, having enough function, set of teeth, and self-confidence. If you work in the media, for example, if you work as an actor, for example, or maybe something you need to have smile, to interact with the people for networking, collaboration with various agencies. So it will definitely affect their productivity and the well-being, with their everyday life. So it is very important. As severe oral hypofunction often correlates to systemic issues also, like cardiovascular disease and aspiration pneumonia and things like that. So we need to have adequate number of teeth. And you asked just now regarding the what kind of 60-20 program supports in terms of healthy aging. It is very important through this 60-20 campaign, in terms of policy-wise, we hope in various settings they adopt healthy settings, policy, or policy as a whole, to make sure that for example, if you work in certain agencies, the policy says that must provide clean water or plain water, and also have some facilities for them to clean their mouth, have a mirror to do mouth self-examination, for example, at least, and also in terms of the company or the agency's policy must make sure that they go for wellness on workers policy, making sure that the workers are fit to tackle non-communicable diseases as well as oral health as part of the non-communicable diseases. So it's very important in terms of policy-wise, adopt good NCDs and oral health policies together, make sure they are integrated. If you have been having this policy, for example, to tackle NCDs, sometimes it is not integrated with oral health, oral diseases and conditions. So I also noticed some companies, for example, they have certain coverage of where the staff can claim for certain care for healthcare, but unfortunately when it comes to dental, they are not able to claim a certain amount or not at all, sometimes. So the company policy must be strengthened. The agency, public or private or NGOs must make sure that in any settings, we must make sure that there is some good oral health policy to tackle non-communicable diseases as a whole, including oral diseases and condition. Secondly, in terms of the supporting environment, it is where this 60-20 campaign is also highlights the importance of the environment must be supportive for tackling NCDs and oral diseases. For example, like I mentioned earlier, have a facility for them to check their mouth, and is it okay or not, do mouth self-examination, or maybe they can brush their teeth at the office. And if you mention about the elderly places, elderly homes or institutions, all that kind of facilities must be there. There's some policies also being put at the conspicuous area so that people can see all these other policies that we need to do in our organization or agency. And also look into some health promotional messages to tackle NCDs, including oral diseases and conditions, so that we remind them, have you had your annual dental checkup? Have you done your mouth self-examination? Have you been reducing sugar intake to tackle NCDs and also oral diseases? Have you reduced, please, no smoking sign? I've noticed some restaurants, for example, they have smoking signs. The policy is there. But in terms of practice, I noticed also some smokers just beside the poster. So we need to also enforce this so that the environment is supportive for better health, to tackle NCDs and oral diseases together. Another thing is about the information capacity development. It's very important to make sure that the community, particularly the elderly, and actually to get good oral health, it doesn't start with the elderly itself. It has to start from the very beginning of life. Because good oral, because oral diseases are cumulative from young age to the old age. So oral disease interventions must be integrated with NCDs and cut across life course from the very beginning. If you can prevent it from the very beginning, for example, in Kuala Lumpur, we have quite a number of school children having about maybe, according to the survey, with caries-free status. So because of the literacy, because of the family rules to prevent oral diseases and things like that, in Kuala Lumpur, for example, the prevalence is a bit higher in terms of caries-free mouth. So then it's easier and not burdening some to our services to cater for all this when, from the very beginning, because they are already caries free, for example, So if you have so much caries from the very beginning, can you imagine at the end of their life, when they reach 60 years old, they could be very complex to treat, So it is very important. Like I said again, the policy, we must ensure that we adopt good policy to tackle NCDs and oral diseases and conditions at any settings, any offices, wellness on workers and things like that. Secondly, it's also very important to make sure the environment is supportive to better oral health. Thirdly, is also good to make sure they were promoting to make sure that the capacity development of the people so that we have better literacy on oral health and tackle as well with the NCDs, so that we can do prevention. Prevention is better than cure. Ministry of Health is shifting its paradigm from treating the sick care, from sick care to more on prevention, promotion, wellness, and healthcare. So we need to prevent it because prevention is better than cure. And also we need to strengthen community participation. There are a lot of community participation and engagement and also involvement and collaborative effort has been done under the 60-20, whereby we work closely with the private sector, with the non-government organization, with other ministries in the public sector, whole of government, whole of society, whole of nation, to make sure that we can integrate well, as well as the community leaders, and also to some extent international partners, to make sure that we can tackle this holistically. Yeah. So it is very important whenever that we organize events like this, we have participation from all the stakeholders, because everybody play important role and complement each other, so that we can strengthen our effort to approach this and tackle it holistically. And I also would like to highlight certain matters. For example, in there also some we need to some extent we need to reorient our healthcare services, whereby we increase we are trying our best in the Ministry of Health, for example, to tackle to detect early by conducting more expanding more dental screening for the elderlies, and also and we are doing early intervention as well across life course, to make sure that we can prevent oral disease from young age as they grow older later. And we also highlight the importance of nowadays is on self-care, because whenever the environment is supportive to health, as much as we have planned it well in terms of policy, is quite holistic already. When it comes to the implementation, a lot of promotion has been done, it has been on place in the social media, as you can see. And most importantly, we want to make sure that whatever that we have done it, we want it to be translated into action, whereby self-care is very important. They need to check their oral health conditions every day. How are they doing in terms of the outside of the mouth, orofacial structure inside? Is there any, for example, any problem with their teeth, any gross cavities, any bleeding gums before and after brushing teeth? Is it clean? And look at the mirror, is it okay or not? Is there any white patches in case of any early signs, any ulcer that has not healed for the past 2 weeks, that to detect early in terms of oral cancer, risk of premalignant lesion and oral cancer, and any problem swelling here and there. So if we want to make sure that as much as possible, the community take proactive action and be responsible to their oral health, so that we can make sure that not only the health sector is looking very much to ensure to provide good oral healthcare system, but also the individual and the family. Family wellness is also very important, not to make sure that not only the individual is excellent in having good oral health, but also the whole family. When we have more family good in terms of oral health, then the community becomes better and the whole country becomes better in terms of taking care of oral health. So that's why it is very important to look into this 60-20 campaign. We also inform everybody that at the end, when we reach elderly age, the aim is to have at least 20 teeth. It is no longer acceptable to wear denture, full denture, especially nowadays, because natural teeth is the best. So I hope that we can work more and collaborate more with all the stakeholders, so that we can ensure that our people aware and take action to improve their oral health and be successful when they reach 60 years old and above. Thank you.
Yes, Dr. Mus, because last week we have a community project under the SMILE programs, and they are happy with this campaign 60-20, because they said that this 60-20 campaign like giving them a new life goals. Before they said they need to pension with 1 million so that we can have a happy pension in life. But now with this 60-20, we have another life goals. So they start
Yes.
to count, they think, oh, now I have 24, then I need to retain this another 4 before they had reached 60. Then I think this is a very good campaign, right? To give them the new life goal,
Well
right?
done, well done. Thank you so much for supporting the campaign. Dr. Arif, I also want to inform, it is very important for us to inform and make them aware. For example, that they need to have at least 20 teeth and above, right? Permanent teeth. So whenever we do campaign also, we have some activities. For example, we ask them to have a look at the mirror or, check how many teeth you have. So they count. And interestingly, we notice some elderlies, for example, have perfect teeth, and also some have 24, 25. We hope that more leaders also can play a part, and the elderlies can also, who are champion, please share, integrate and work closely with us so that we can share what have they been doing, all these years that they successfully managed to take care of their oral health, that they have more than 20 teeth. So it is very good thing to also sharing if we can have collaboration with the community and some individuals who are very successful in these aspects as well. Thank you.
Yes, thank you, Dr. Mus. I think campaign 6020 gave us a very concrete example how prevention and function can be translated into measurable healthy aging. From this discussion, we can see that Malaysia already has a policy directions and programs ideas. However, to ensure that implementation is effective, we need strong evidence, local data, and community level understanding. I would like to return to Mr. Chai on this issue. As a senior researcher at My Aging, we have policies and blueprint, but implementation needs evidence. What data, research, or community level indicators are still needed to guide better planning for Malaysia's aging society?
Thank you, Doctor. I think a good example to start, and one of the less known statistics that we use, that we try to educate the public on, is maybe a slide 4. Image number 4 would be useful here. I know we talk about 10%, 11% of the population are older persons, warga emas, tetapi the reality of the situation is that people don't live alone, right? And I know we always like to highlight warga emas living alone or dying alone as one of these so-called news headline, topic grabber, attention grabbing headlines. But one of the quiet crises we are trying to highlight is that the percentage of households with older persons. We look at older person not as a relationship to the head of household, and I think KRI uses the same household income and expenditure survey microdata as we do. And one of the more important statistics that we like to show visually up to the last microdata that we have is percentage of households in Malaysia with at least one older person has increased from 23% in 1999 to over 40% in 2024. In the same time period, the percentage of a household with at least one children under the age of 18 has dropped from about 67% to about 47%, less than half. So the situation of the sandwich generation is very real, but the real change in living arrangement for older persons in Malaysia is the percentage of households where isi rumah tu hanya ada warga emas 2 orang, usually 2, usually 3. The percentage of elderly living alone has always been historically low. Malaysia, it doesn't exceed 8% or 10% among older persons, and nationally it's roughly about 3%. Because unlike Europe or unlike more developed countries or smaller housing situation, we don't have 30% of our population living alone. Macam orang muda kan. In Malaysia, even adult people, aged 21 and above living alone is roughly about 5% of all households. So Malaysia living alone is not a very big trend, unlike in other countries, maybe 20-30%. So what we wanted to highlight the scenario here, why is this data or statistics particularly important, is to show that, it's not always negative. Next slide. The key issue we always try to highlight is that since this is a growing trend, the percentage of households with at least one older people, then what can we do to help? What can we do to support? The fact that many of these older couples live on their own is actually an indication of ability or independence to live in their own household. They own their own home, they can manage their household affairs. So how can we encourage aging in place? That's the core issue we are trying to address. That's the core issue we are trying to promote. A narrative where older persons, can look after their own health, follow up on medication, do their dental checks. So the question here is not their living arrangement. It's not about forcing people to change their living arrangement, but about what kind of support we can give to them. Do they really need alternative housing? Do they need, co-living arrangements? What kind of services and facilities we can provide to them. I'll give you the next slide for illustration of why it is important to look at data properly and remove our earlier narratives from our assumptions. We always think that, isi rumah dengan warga emas, miskin. Isi rumah warga emas duduk berseorang, miskin. But the truth of the matter is that can't be correct, right? A lifetime of households, people earning, family living arrangements, it can't be always poor households. So when we look at the data and we control for household size, I know Malaysians, we like to say that T20 is outdated, M40 is outdated, but there's nothing wrong with it statistically. That's how it is supposed to function, quantiles and all that. But because we forgot the quartiles are a function of the average household size. It's based on, the PLI is based on 3.8, or 3.9, previous successive versions of household members. Once we apply the household size, you can see that households with older persons are not necessarily poorer than households without older persons, right? This is the thing that we are trying to change people's perception on, so that we can look at the problem more accurately and really figure out what do they need. I think for us as researchers, next slide, slide number 8, we have to take note and acknowledge that many of the issues that older persons face in their day-to-day living, family problems, household challenges, it is not just about long-term care and health policies or even pension policies. It's actually also about, like the age-friendly cities and communities domain. It's about transport. It's also about how we help caregivers. It's not a coincidence Japan has a law on against elder abuse and promoting and supporting caregivers in the same law. That's maturity in planning. That's maturity in legal design, so that we are not just talking about abuse. We are not just talking about parental care. We are also talking about supporting caregivers, helping families help themselves. That is what we are trying to do. So we cannot have an urban planning policy that says that, a very common Malaysian problem, nobody wants a kindergarten in their housing area. And then tomorrow we complain, we have to send a kid to a kindergarten so far away. Japanese children can just walk. But who wants an old folks home in their neighborhood? Who wants a childcare center in their neighborhood? We have this in the law. You have to get the permission of the neighbors to get a license or a permit to start a facility and service. And our people don't like it. Our population doesn't want it. Nobody wants it in their neighborhood. It's the classic not in my backyard mentality. And we are facing this problem every day. Operators are having challenges, who wants to invest in starting a facility when tomorrow the next round of licensing, neighborhood disagree or person disagree, and then they are forced to shut down. So we must look into this, not just from digital literacy of older persons, the capacity building of warga emas and also the NGOs involved. We also must talk to the government side, the policymakers, change their thinking, and also engage the public to actually say that you are actually part of the problem, not the solution. So we have to be honest enough to say that why certain things are not happening, why certain things are not taking place, because the excuse was, orang kita tak akan setuju. Orang kita tak akan nak benda-benda ini. So if that's the case, then we can wait. Malaysia does not have a national health policy, let alone a long-term care insurance, no health insurance, no health long-term care insurance. We don't have a pension system that pays a monthly social pension or occupational pension. We pay by lump sum. Nobody even dare to suggest it. It's in RMK 13, but who wants to take the first step in suggesting solutions like what Singapore has done with CPF Life, and everyone is, who has worked has a pension guaranteed at about 500 Sing dollar a month until the day they die. So we have to be honest enough to say that, are we looking at all these various cross-cutting issues, and where is the bottleneck, and where is the kind of data that we can tell and explain to the public that you have to use evidence when you come up with, let's say, bantuan warga emas. Why 600 ringgit a month? Is there a calculation that says this? What is the problem? Is it really about the amount that's given or the number of recipients? When they talk about fiscal burden of population aging in Malaysia, there's no fiscal burden to the government. The government is only paying civil service pensions and bantuan warga emas, 1.5 billion, 1 billion a year for about 160,000 bantuan warga emas recipients. So what other fiscal burden we are talking about? If it's healthcare, then say specifically that's for healthcare. The real reason for many of our problems is that we are all using general terms and we are not really pinpointing the specific issues that is causing all these excuses being used to delay reforms, to delay introducing changes, because there's very poor public understanding and very little political will. Thank you.
Yes, Mr. Shah, even our Lindung 24, the Lindung has been retracted in less than 1 week. So I don't know how we are talking about policy, but the implementation has been done, but retracted again. So how we expect with the health and everything, right, Mr. Shah?
I think one of the biggest problem is that we can ask questions about Lindung 24/7. Definitely, there's nothing wrong with asking questions like, what are we getting? How much is being deducted? But the way we instinctively do is to pull it out of discussion, pull it out of circulation, to reduce controversy, to not actually address disagreements directly. That's how improvements are made. If people disagree with the scheme, then how can we fix the scheme so that it's more acceptable? You don't introduce something and expect it to be perfect or expect it to be accepted by everyone. You will always have people disagree. So is there something we can do to have these public conversations, to have this public acceptance or listening to feedback, and then we are not afraid to make those changes in the name of putting out something that warga emas nak ataupun the public can accept. So but at the end of the day, if we cannot convince the public on the soundness of our evidence-based recommendations, then we should not expect the policymakers or the political masters to actually make the jump or the leap. So it must happen in a transparent manner. We must be able to defend our policy choices, and we must also make sure that if we want to see real change, we must be, have the courage to actually say that this is going to bankrupt this particular agency down the road, or we have these holes that we are digging, and if we don't do something, it will not be sustainable. So data is so sensitive in this country. We are not sharing sufficient information, and we only like to present nice things, the rosy picture, we are doing this very well and all that. But every time something bad happens, the public reaction is to blame, not to solve the problem. So I think it's very sad when we work in the area and we can see that there are proper arguments for certain things we need to do. Another good example is PADU. But unfortunately, we don't really need all the modules in PADU. For a household registry to work, we only need the first module. And you know what? Under NRD, the National Registration Department, there's already a law that says that you must update your alamat rumah in your IC. But we don't enforce it. So the data doesn't match. Last census, only about 15% match with NRD data. We have a situation where a lot of people aged 130, 120 years and over still in NRD data. We don't know where our centenarians are. We have so many issues and problems, but the public, happily feels that it's not an issue. The less the government know, the better. But at the same time, if we want targeted assistance, we want targeted support, then we have to talk honestly about what is our mechanism here. How does it work? Will it really be useful? Buat petanya berapa wang awak carum or install for a loan. Once I fill up the data, next month it will be different. So we should think about statecraft, the tools that we can use to educate the public, to make sound policy decisions. Sebab ultimately, kerajaan ni duit dia datang daripada rakyat. The money comes from the people. If you say you want things for free, essentially taxpayers are paying for it. There's no other source of income for the government. The government cannot be business. So we have to be transparent, we have to be upfront, but more importantly, we have to be honest and tell the people that if this is something that you want, we have to invest in it. It won't fall out of the sky, and this is something that we lack a proper conversation about.
Yes, thank you, Mr. Chai. That's a very useful point. Good data and research can help us identify needs, monitor gaps, and design better programs. But even with good evidence, implementation will depend on whether the care system is financially and socially sustainable. This is especially important because many of the adults still depend heavily on family members for care. Now, I would like to ask Ilyana about the sustainability of the care system. The question is, many of the adults rely heavily on family members for care. How can Malaysia build a more sustainable care system that's affordable for families, fair to caregivers, and financially realistic for the country?
I think currently we're operating on the assumption that, as Mrs. Chai highlighted, care currently, the financial responsibility is not on the government, it's not on the country, it's on the families themselves. So it's something that's invisible, but actually it is exerting its cost in different ways. For example, in terms of economic productivity. So we really have to be looking at care when we're talking about fiscal sustainability, those kinds of things. We can always argue that we should be spending elsewhere, but we should also be looking at how this is an investment and that we are preventing higher costs in the future. And I think this also applies to healthcare when we're talking about prevention of non-communicable diseases. So in order to make sure that we have a sustainable care system that is affordable to families, fair to caregivers, we need to make sure that it is prepared and well governed. Malaysia needs to reform the aged care service delivery landscape to meet the demands of those who require intensive care. And an example of what should be done is, one, streamline processes to facilitate registration of care centres, which allows the establishment of aged care facilities at more scale. And I think Mr. Chai can also add to this, where a lot of care centres are operating without official licenses, and this comes into the issue of quality and maybe also availability or accessibility. And we have to remember that aging results in a continuum of care needs. So as elderly age further, they may age into disability, and this means that they do need care facilities, and it should be readily available, because we can't just be saying, okay, you can age at home, you can age in place, we won't develop these facilities for you. But in reality, at one point, maybe they will be needing care facilities. And this has to happen alongside other initiatives that promote aging in place for those who do not need to be placed in a care home. So for those who are healthy and independent, since the government has a focus already on social support services such as PAWES or Pusat Aktiviti Warga Emas, these are currently social activity centric, but perhaps it would be a good idea to convert them into caregiving centric centers or acting as respite centers, because I think PAWES currently have been reported to be underutilized or underfunded, and we already have the infrastructure. How can we make it more, how can we increase the usability of this for the elderly? And this should be in line with addressing things like infrastructure, transportation, healthcare access, to really create an environment that promotes aging in place. So one example that I can describe could be in Australia, for seniors who want to age in place, they can access certain lifetime funding for home modifications to cover things like rails, ramps, bathroom retrofits to prevent falls. So these things are some things that they consider when they want to promote aging in place in their population. And the financing of such a care system also has to be considered. And I think this needs to be data driven. So the Ministry of Health, Ministry of Finance, KPWKM, they need to start now to study different funding sources, contribution levels, benefit packages, and so on, in order to define what a long-term care insurance looks like. Because we cannot just say we need one, but not know what are the policy objectives of this long-term care insurance and what are the ground-up realities that need to inform this long-term care insurance. And we also need to be looking at the caregiving workforce, where interministerial cooperation is needed to improve career pathways. So things like TVET, national certifications, a progressive wage model with both monetary and non-monetary benefits. These are things that are not necessarily under KPWKM, but needs to be looked at in order to make our care system sustainable. So I think overall, what we need to do is look at our care framework, our care policy, which we have, and make sure that it moves forward with cooperation between government, NGOs, private sector, and it needs to focus on enhancing availability and quality of care services, not just long-term care, but also social support for those who want to age in place. As Chai said, I think if we want to if we want it, we need to invest in it. And I think that's my opinion on this.
Thank you, Ilyana. That highlights the importance of designing a care system that's not only compassionate but also practical, affordable, and sustainable. In health services, sustainability also means better integration. Rather than treating oral health separately from the general health, we need to consider how oral health can be embedded into existing healthy aging programs, community services, and primary care. The next question will be on Dr. Mustafa. Oral health is closely linked to nutrition, speech, confidence, and quality of life. What could be the practical steps can be taken to make sure oral health a stronger part of healthy aging programs?
Important matters which relates to the principle. This is also introduced by the WHO, that we need to firstly look into whatever that we do, we must consider to implement it in terms of to look into public health approach to oral health. That is very important because most oral diseases and conditions are basically preventable, and this can be effectively addressed through population-based public health measures, upstream policy interventions such as those targeting social and commercial determinants of health. Yeah. So it's very important that we look into, for example, in terms of social determinants of health, we look into the vulnerable population and marginalized population, including the elderly. And because like I said, for healthy aging, it doesn't start on, it's not only at the elderly age that we need to look into, but the investment starts from the very beginning part of life. Yeah. So we need to look as a whole so that it can be a bit more holistic. Yeah. So, commercial determinants of health also we need to look into this matter because there are many aspects that, for example, in terms of private sector, are promoting, for example, certain products or food that can cause detrimental effect to health. So we need to look into ways on how we can control it, and so that we give better options and also limit certain unhealthy products that is consumed by our population, particularly our elderly, yeah, to make sure that they get healthy food. For example, in terms of the food or drinks that with high sugar, you know, and unhealthy food. So we need to consider having work closely with the nutrition. Now that we have, for example, war on sugar policy, whereby the Minister of Health works closely with various agencies and in the community to limit the sugar intake of our population, because Malaysia, as you all know, is one of the countries with high consumption of sugar, as well as obesity is on the rise. So we want to make sure that, and diabetes also about 1 in 5. So we must make sure that as much as possible, we need to tackle this by tackling social and commercial determinants of health. So then also we need to look into cost-effective interventions, those evidence-based that we found effective and good for tackling NCDs as well as oral diseases and conditions, then we need to make sure that we implement it as much as possible and expand what is effective and what's not effective. What those not effective, do not implement it anymore. Those who are intervention that is effective, we need to do more, for better high population reach and impact. So midstream initiative includes creating more supportive conditions in key settings like households, elderly homes, schools, workplace, long-term care facilities and community venues. So downstream intervention are also critical, like one-to-one, patient-to-patient or individuals level, including essential prevention and evidence-based clinical oral health care. So that one is very important for us to take note in terms of the public health approach to oral health. Secondly, we need to make sure that in any way that we can, there is a good integration between oral health to primary healthcare services, because that's the most important cornerstone of the healthcare services that people can access the care. So we must make sure that we need to work out with various stakeholders to make sure that it is very well integrated. For example, in terms of tackling type 2 diabetes mellitus. So we have enhanced primary care in programs, and also we have clinical practice guidelines on diabetes mellitus. So we need to work as a team from the medical side as well as oral health sites to make sure that we communicate well and cross-refer between each other so that we can manage the patient as a whole and tackle this type 2 diabetes mellitus. Among others, include about cancer, obesity. For example, they also have this the first 1,000 days of life campaign, whereby it starts from antenatal mother, patient who people who pregnant up to the first 1,000 days of life. So it's very important. This contributes until they age up to 60 years and above. So in any way that we can, health promotion, prevention, in terms of providing care services, in terms of providing palliative care services, or in all spectrum of care services must be made. We must make sure as much as possible integrated. So yes, including it's very important. So another thing is about innovative workforce. It's very important to respond to population need. There's some we need to strengthen this workforce model to make sure that this is very important, so that we can make sure that we can incorporate oral health as part of the activities. For example, task shifting on certain activities to take good care of oral health by the carers, for example, and in the elderly homes or institutions or daycare. And also in the action plan of for the healthcare for the elderly in the Ministry of Health, we also work closely with the community nurses and also dental therapists. Now that not only they see children, we are promoting our dental therapists to also provide advice and care to promote better oral health among the elderly. So that's also important. Innovative workforce. People-centered oral health care is very important because everybody plays their role. They need to make sure that it is people-centered. All the feedback that we receive from our stakeholders need to be considered and value-based, so that we can implement it better, holistically, taking consideration all the feedbacks to strengthen our deliveries of services. And then we must make sure that the interventions that we provide is tailored across the life course. So certain for the elderly and for the young adult, we must make sure in general we have to see as a whole so that it is effective for each target groups. And also we need to optimize digital technologies as much as possible so that sometimes we have limitations in terms of resources. So digital technologies can be very efficient, can be very innovative. For example, use of AI to create some messages, video that is very interesting to get their attention and to promote better health. some innovation in terms of like for example dental information system is very good to capture all this information. Apart from that, the WHO also highlighted certain aspects and domains that is very good for us to consider to make sure that our healthcare system is sustainable and look into all these matters. For example, in terms of governance, political commitment, in terms of financing, in terms of strengthening leadership. It is also very important so that we take pragmatic actions, that when we notice certain gap in the service, we need not to wait for so long sometimes, and we can plan and take effective actions to make sure that we can tackle it with immediate effect, or for short term, medium term, and also long term, depending on the issues. So this is very important. Capacity development, leadership is very important. This is the most important part to make sure that the delivery of the service is can be done nicely by the team and supported by all the stakeholders. Also, we need to consider in terms of oral health promotion and disease prevention. So as much as possible, we need to do more apart from promotion. We hope that will also translate to their action, that they can have a better self-care. Like I mentioned earlier, good policy, good supportive environment, good knowledge, literacy that translates into action, community involvement, as well as the research is also very important on this matter. And oral diseases prevention, we need to consider and invest a bit more on prevention, and so that we can prevent as much as possible. For those who are already in the wellness, who are performing well in terms of their oral health status, we need to make sure that our community, our people, our individuals can really maintain that very well. And so this is very important. If we can maintain it very well, and it becomes so easy for us to tackle with lesser maintenance, lesser cost, not to put burden to our healthcare system. And also look into information system. We need to make sure that we have proper strategic planning. When we gather all this information, we do research, all kind of research that inform us, but did we take effective actions to make sure that all these problems or this gap that are being addressed well? This is very important. Sometimes we overlook this, and the KPI is not achieved. Certain KPI is not achieved. Did we really go down to the ground and really look deep into it and really tackle it holistically? Did we communicate well with all the team players to make sure that we address this very well, so that we respond to the population need? And of course, research agenda. In many cases, the Ministry of Health, the Oral Health Program, has been working very hard to make sure that we have this National Oral Health Research Initiative. So it is very important so that we work closely with all the stakeholders, so that oral health research agenda is also integrated. For example, with the National Health Mobility Survey for the elderly, in the next survey around is very important, and or any other stakeholders that performs research, we need to consider, in what way, so that it is interagency, intersectorial approach, so that we can look into oral health as well, and give some value-based research to make sure that it is well and holistic. So I hope I've answered some of your questions. In case if I miss anything, please let me know. Okay, practical steps to be taken in terms of stronger part of healthy aging program. Apart from that, I also would like to highlight some community level actions that we have done. To give you some example, in terms of we have kotak program kesihatan oral tanpa amalan merokok. From school age, we go and do screening to make sure that, for example, as you know, tobacco is one of the risk factor for not only lung cancer, and also it causes problem to the gums, and teeth stain and things like that. So teeth staining and things like that. So we through this kotak program, we screen active smoker from school, we do intervention to make sure that they have a quick date and stop taking vape or smoking from the early age, so that we hope that we can do more from time to time, and we monitor annually at school level. So this is also an example of a school community program, and also oral health screening. In terms of access, we are working very hard to look into to access vulnerable population, particularly the elderly, as well as one of the target groups, including people with people with disabilities. Yeah? Sometimes we have programs for the elderly, and have domiciliary program, kampung angkat program perumahan rakyat. Yeah, we have we work closely with the health team. Yeah, and also we receive referral from the carers, maybe from the individuals, and also something we receive from the specialists, and also for us to look into this. Yeah. So apart from that, we have collaboration whereby we do a lot of perio screening, and we have cross referral to tackle NCDs together, like I mentioned earlier, type 2 diabetes mellitus. We also promote mouth self-examination to make sure that we can detect any dental problems early, and also oral diseases early from their self-care. And if you are not sure, they can come to dental clinic, and compulsory dental checkup, especially perio dental checkup, 18 years and above. And we do a lot of oral health promotion and work closely with all stakeholders. And also we do smoking cessation at dental clinic level. Yeah. And apart from that, we have all this has been highlighted in the National Oral Health Strategic Plan. Yeah. And yes, so that's among the important ones. Also, we go digital. Whereby we have dental information system. We can monitor any gaps in terms of service, access, and various aspects in terms of the services that we provide across life course, and also for the elderly. So this, to sum up, I feel that there are many efforts has been done throughout the healthcare system, but to make it for the community level, at the individual level, we hope that the person can do a good self-care, and some community leaders at community level can play their roles hand in hand with us. And for example, by joining this club Warga Emas can also be very beneficial. They have this elderly club. Have we explored? Recently, I went to Institute Social Malaysia. They have perintah kerja khidmat masyarakat, for example. Did we explore? We can, whereby these people, they need to perform some community works, under the act or under the law. They need to perform certain hours, for example, to provide perintah khidmat masyarakat. Yeah. So maybe we can also explore in terms of why not we take the opportunity or explore the opportunity, having these people to also help. We can develop a module, for example, and then they can do oral health promotion, and make sure that they can provide some advice and help the carer. The carer can be their supervisor to provide oral healthcare advice and monitor and help some elderly who are in dire need who need for oral hygiene care and things like that. So there is a lot of potential actually that we can explore with various whole of government, whole of society, through this whole of government and through whole of society approach. Thank you.
Yes, thank you, Dr. Mus, for your insight. Actually, as mentioned before, our community project in Sabah Bernam, right? So we are also introducing what we call it as OASA, Older Adult Smile Ambassador. So we train about 10, it's like a duta gigi in KKM lah. So it's like we train 10 people, but specifically on warga emas. And then we train everything about how to take care of their teeth and everything. And during the community project, they are the one who did the promotion, how to brush their teeth well, how to take care of the denture and everything. So yeah, because our mottos for this month is to warga emas perkasa, inspirasi generasi. So you want to empower the warga emas to be the changes to the community lah. Okay.
That's
Right.
wonderful.
So
That's wonderful. Yeah, congratulations.
Yeah.
There are many potentials. Like the elderly, sometimes they for those who are very productive, we can also involve them and be a step ahead on and share their experiences. Those volunteers, for example, like you mentioned, is really good. We need more people because our staff is quite limited. So our resources are also quite limited. If we have more volunteers to support us, like in Japan, for example, the elderlies help to do oral health promotion for the school children, for the kindergarten children. So that is really good. Yeah, in Scotland, for example, it's the same thing. Sometimes more volunteers, we can have more volunteers. That will be very good from the community to help back the community. Thank you.
Yes, thank you, Dr. Mus. I think, and this is the end from my questions. And I think we need to look at our chat box. Is there any related question that we can show you? I think as Dr. Mus mentioned about any innovative healthcare services, I think there's a question from Kamarul Anwar Siddiq 643. For seniors who are bedridden or have dementia, visiting a clinic is nearly impossible. Are there plans to heavily expand mobile dentistry unit for home visits in urban areas?
Yes, thank you very much for the question, Mr. Kamarul. Okay, so we have in the service, we have domiciliary service, whereby we provide home visit and care for the elderly. For example, those who are bedridden, who need help, who need support. We have special care dental specialists to look into all the aspects that is required by the patients. So apart from that, the specialists also train our team so that at primary care level, we can also do some home visits and provide domiciliary care services for people who need. The complex cases will be referred to the specialists, and the specialists will also join. This is something, one of the way forward that we look into, so that bringing dental care services or healthcare services to home. So we receive referral and also by individuals and also from health team. They have domiciliary team. Sometimes we go together with them. So in the urban area as well, we have domiciliary team to look into these aspects. And so we have Kampung Angkat program. Sometimes we notice some cannot participate in the campaign as other communities. So we will do some home visits and provide care for them. So yes, we hope that we can train more and expand the domiciliary services for our people here in urban area as well, like like other states. Of course, as you already know, that in Kuala Lumpur and Putrajaya, the population, is very condensed. We have high population as well as in Selangor, for example. So it's a big challenge for us, but we will work and also collaborate with our specialists as well as other teams from time to time to strengthen these domiciliary care services. Thank you.
The questions also from the chat board that I can share with all the panels. Mental health and loneliness are huge issues for the elderly. How can we design community model that keep seniors socially active and purpose rather than just medically treated? So I think the question can be answered by Mr. Chai.
Yeah, I saw a few questions about we can address it together, fertility rates and also loneliness and all that. I think the first key issue here is that we already have 170 over pusat aktiviti warga emas that is directly funded and supported through Department of Social Welfare. Before that, before Jabatan Kebajikan Masyarakat made that shift in 2012, 2016, there was a 22 Pusat Jagaan Harian Warga Emas. And we also have Club Warga Emas, those terms, senior citizen clubs, Club Warga Berida, that's how far it goes. Maybe started before Merdeka pun ada. Tetapi di bawah Kementerian Kesihatan, the Ministry of Health, there is also a lot, I think 700 to 800 Club Kesihatan Warga Emas. Of course, the Kementerian Kesihatan rebranded it to Club Warga Emas as well. And these are all supported through the various health clinics, clinic kesihatan. So the issue here is, I think the government recognizes that older persons need to be actively engaged. There must be activities for them. But we don't empower the seniors to make a difference. We still think about a term where kita do something and then they will come. Tetapi when my aging experimented with the concept of University of the Third Age ataupun U3A in 2008, we shown and proven to the government that warga emas boleh buat pertubuhan dia sendiri, boleh uruskan program dan aktivitinya sendiri mengikut according to their own interests and their ability, to attend classes or lectures. And when COVID came, dia move online. So now persatuan tu berdaftar sebagai Persatuan U3A Malaysia. Dahulunya dikenali sebagai U3A Kuala Lumpur dan Selangor. So here we can see that what is lacking is actually empowering the civil society groups to actually arrange these programs and activities, give them room and support their development, how to organize themselves, how to fundraise, how to carry out activities, and how to measure impact. But at this level, our policymakers is still counting, how much you have spent and all that, and then counting numbers, bilangan ahli di pawai. Itu saja ya. I mean, setakat itulah level kita. Walaupun program kesihatan warga emas pun dah dijalankan di bawah dasar warga tua negara sejak 1997. But we never analyze the data. Sama juga dengan data return kesihatan. So at one point, we must ask ourselves, since we are doing so many of these facilities and services, since we have surveys and all that, so how do we measure impact? That's the real issue. So I would also take the opportunity to answer the very first question about medical treatment and our focus on orang kata pencegahan. Prevention is better than cure. So kedudukan pusat-pusat jagaan warga emas ini ataupun pusat aktiviti warga emas ini adalah sebenarnya it is for prevention. It is to keep the elderly active and productive. So if you say how do we design community models? Invest in the development of civil societies. We invested it. We tried to get them to work together to create a Malaysian coalition on aging. We also tried to get all the operators of care homes to start age cope, ataupun persatuan pusat jagaan berkediaman di Malaysia. Because at the end of the day, di Malaysia, aged care is still not recognized as a proper industry. I can relay a very simple story. During COVID, pusat-pusat jagaan, pekerjanya ada masalah, they have problem going to work. Sebab masa MCO, they are not recognized as critical or essential service. But because as luck had it, kita dah tubuhkan Persatuan Age-Cope, maka Presiden Persatuan ini, Encik Darren, he spoke to KDN and KDN recognizes that we have to make an exemption. Tetapi by that time, untuk keselamatan, kebanyakan pusat-pusat jagaan telah menetapkan bahawa pekerja kena duduk sekali dengan penghuni untuk mengurangkan risiko, the risk of infections. So these are really practical examples how the industry and how the idea of all these things that we have done to develop impact. So daripada berkira berapa banyak pusat aktiviti warga emas ataupun kelab warga emas yang kita ada, kita kena betul-betul tanya, adakah klinik-klinik kesihatan, domiciliary care, are we really engaging them in social prescribing? Salah satu lagi trend baru ya di bawah perkhidmatan geriatric dan juga perubatan, where we talk about hospitals at home, we talk about step-down care, we talk about social prescribing. All this will require better coordination in order to create actual impact on the ground. Tetapi sekarang kita belum ada direct dedicated funding. So apa-apa yang berlaku sekarang ni semua is happening on an ad hoc basis lah. Dan we don't really measure its impact dalam mesyuarat majlis dasar warga emas negara, the National Advisory Council. Setiap jawatan kuasa kecil ada melaporkan inisiatif-inisiatif ini. Tetapi kita masih kurang dari segi penilaian impact dan berapa orang yang betul-betul mendapat manfaat daripada program-program berkenaan.
Thank you, Mr. Chai. Yes, and then next we have another questions. I think this one for Ilyana. Another question from Kamaru Anwar Sidik 643. The question is, we keep hearing about the national policy for older persons, but on the ground, families are still dealing with overcrowded hospital wards and expensive private nursing homes. What could be your response on this question, Ilyana?
Yeah, I think it was mentioned earlier that having policies and the implementation of such policies are, different things. We may have everything on paper and it looks really good, but on the ground it's not being rolled out, or it's not being taken seriously by any specific agencies. So we have the direction in the National Policy for Older Persons and other policies, but we don't have I think I mentioned just now, a cohesive or a universal care system. So we still don't have sustainable financing for long-term care. We don't have widespread home-based and community care services. We have issues with our long-term care facilities and its workforce. So these things are still developing or still not in place. So we cannot really realize the national policy or any other policies for now. And I think when it comes to overcrowding in the hospitals, what was mentioned earlier about the social determinants of health is very pertinent, because a lot of the health outcomes that we see in later years and how we live our end of life in worse health is actually shaped by what we do in our early years and throughout our life. So the social determinants of health is where people are born, live, grow, play, eat, and these things actually shape our health outcomes more than healthcare itself. So in order to actually reduce this and make sure that our elderly are also able to live with dignity, we have to be taking a whole of government approach in tackling things that don't necessarily look as if they're within the purview of your ministry. So human resources, how does their policies impact health and the aged care? How do policies by the Ministry of Housing impact these things as well? So we have to start shifting our mindset in terms of policy from siloed and just looking at one problem towards looking at a multifaceted intersectoral kind of approach. So
Thank you, Ilyana. I think the next question will be on Dr. Mus. Okay. With so many shortcut dental products available today, such as mouth sprays and whitening strips, do you think people are becoming less care regular dental care? This first question from Izan Najwa 9873. I think this is my sister, asking this question.
Right. Thank you very much, Izana, for the wonderful question. I feel that they are, to some extent, these people are the ones who, my experience working as well part-time last time in the private sector, these are some of these people are really concerned about their oral health. They tend to come often to dental clinic to make sure that their teeth are white, and also making sure that are they using the right thing and things like that. But to some extent, yes, you are quite right. They try to self-medicate them, self-care them in this way. But still, this gives me a good idea that we should also consider do some health promotion for them as well. Having this kind of intervention at their level does not mean that they can skip annual dental checkup. Yeah, you can because you need to be seen by the professional. How are you doing in terms of your oral status? Because if like I said, the National Survey on Oral Health for Adult, last time they found majority thought that their oral health status is good, but but we found that actually half of them didn't do well. You know, they need some form of treatment. So we based on that evidence, we must make sure that we keep on promoting to these people and also to the social media. If you notice any kind of spray or products like that, we need to penetrate that area, that kind of that platform, and to make sure that people are aware, you know, or give some kind of remark that you know, that does not mean that you don't have you can skip your annual dental checkup. So we need to do more promotion so that there's no shortcut like that as such. And also, of course, I like to take this opportunity, some other shortcuts that you can in a not good manner, whereby people seek for illegal dental services, you know, from at home, in the hotel, at the market. So this is not healthy. We need to inform our people as well. That is not really shortcut. That's not shortcut, you know. That's a bad shortcut, you know, where you think it's cheap and you go for that kind of treatment, and unfortunately it causes a lot of problem later, you know, to your oral health, whereby the teeth becomes mobile and the gums become swelling and bleeding because of poor oral health and not taken care well and not advised well by the illegal dental practice. So we must make sure if you seek for dental care services, you must go for the clinic that is registered with the Ministry of Health under Private Healthcare Facilities and Services Act. And secondly, you must make sure that you receive the dental care services from the registered dental practitioner under the Dental Act. Yeah, meaning registered by the Malaysian Dental Council. So whoever across life course, you know, we must make sure that we receive quality oral healthcare services, and we cannot ignore or choose to visit dentist when it's too late, when you already have the pain. It's too late, you know. So unfortunately, in most cases, it's too late. It's already reached the pulp. Sometimes when you feel the throbbing pain, it's too late. So let's do more. And actually, when you do your promotion, for example, if you use WhatsApp, you know, you can simply, you know, tag, you know, that alias tag to some groups. It's very effective. You know, people can just click that and then they can see your message. Why don't we do it? Start with all the community in your phones. Then we can share more messages quickly to these people. Yeah, so including the elderly. And just to expand it a little bit more, promotion to the elderly, sometimes they listen to all kind of nice music, you know, from the classic FM, you know. Sometimes we can also deliver messages to them through the radio or TV for their favorite channel, so that they can also learn something from it and get the latest update, yeah, for their population. Thank you.
Thank you. As you mentioned, phone before in Dr. Moon, we have also MySejahtera, right, to book the appointment,
Yes.
right?
Yes, true. In the Ministry of Health, we receive patients from MySejahtera, whereby they can get their appointments. And also in Kuala Lumpur, for example, we have a campaign whereby we have it's called Jangan Tolak Pesakit, meaning anybody can come to dental clinic and seek their dental care services. You can also walk in, no problem at all. Yeah, so we have make sure that I've communicated with the leaders to make sure that actually it is a directive from the Deputy Director General of Health through the Mesyuarat Jawatankuasa Dasar and Perancangan Kesihatan Pergigian that we our policy nowadays, we do not reject patients or something like that. We need to receive them. We must make sure that we receive them and treat them according to their needs. And not only from MySejahtera, anybody are also welcome. Even for the elderly, we have fast lane for them to provide dental care services and exclude their charges. Yeah, so it's a good opportunity for the elderlies as well to use the service from the Ministry of Health. Thank you.
Thank you, Dr. Mustafa. That brings our discussion very nicely from policy to implementation. We have discussed policy readiness, economic gaps, care system, silver economy, care economy, campaign 6020, and integration of oral health into healthy aging. But before we close, I would like to invite each panelist to share one final practical recommendation for Malaysia moving forward. Okay, the question is, if we want Malaysia older adults to age not only longer but healthier, what is one action that we must start now? So we start with Mr. Chai first.
Thank you. I think if there's one thing I hope that we can do as a society is actually try to get people to actually think about action on the ground. Very often, the community groups, community leaders, and the local actors don't get enough support to actually make a difference. The people know what they want. So, in the process of giving them what they need, we must also take the opportunity to explain how it will work. Bagi saya, one of our biggest challenge in whether it is bed blocking in the hospitals or whether we are talking about lifestyle issues and all that, I think we need to engage actors on the ground so that we can not just talk about dasar. You know, everybody knows what they want. We don't have to tell them what is the good life or what is a good retirement or what is a good old age. What we need to tell them is, how do you do that? How do you achieve it? And how can the government help? And when we say help, the people must understand that, you know, we cannot have a policy or a program just to help Mr. Chai or help Ali or help Mutu. It must be a policy decision that we can target collectively and it can be implemented sustainably. So bagi saya, perkara pokok yang paling penting adalah pastikan people understand and there are resources provided for these policy actions. Malaysia has so many policies, but they don't come with resources. So that's our main problem. Thank you.
Thank you, Mr. Chai. People understand and make sure the resources is there. Okay, next, Puan Ilyana.
Yeah, I think from my closing statement, beyond making sure that the care system is developed and put in place, I think the main thing that I wanted to highlight is to ensure that care is not just considered a women and welfare issue. It's something that needs to be taken as seriously as we take, economic productivity. So how does housing, economy, human resources, and education work together to build the care system? And it should not be something that is invisible, that happens in homes and is tackled alone in silence. It should be something that is recognized, rewarded, and supported by the community and by the government. And it requires strategizing to be done so that all these players will be able to come together and create a better care system.
Yes, thank you. I think I can conclude that it's not just a welfare issue, it's a national developmental issue. All right. Then next will be to Dr. Mus.
Yes, I personally feel that it is very important to strengthen the leadership capacity at various levels so that we can really work well and take bold actions to make sure that any gaps that we see, any whatever that intervention that works and do not work, is there anything that we missed? How about our workforce? How about our governance? How about our the performance of the KPIs? Did we, if we notice anything like that, it's very important for the leaders to see as a whole and really take pragmatic action and make sure that they do something and take bold actions to make sure that they can really help the elderly population and the whole community at large to make sure that we can really and strengthen the services that we can provide for all these people. You know, I feel that if we notice any gap in terms of the confidence level, in terms of the knowledge, in terms of the tools, management tools that we are not sure how to do well, and all this while we have not been very bold when it comes to taking actions, then we need to really leaders at the various level, meaning for example in my situation at state level maybe, and also at the district level, at the local level, and all across all the professions, we need to really learn, keep on learning, and also find ways so that we can strengthen our leadership capacity and work with all stakeholders so that we can do something that is valuable and meaningful from whatever that we have. A good policy, we have various policies and various monitoring frameworks. So I feel that is very important. Strong leadership that can, if we can have this strong leadership, we can work out with all the stakeholders and make sure that we can do well as a team. Teamwork makes the dream work. Thank you.
Yes, thank you, Dr. Mus. Okay, that's why in our Smile webinar series, we try to include all these things, because tomorrow in the webinar 3, we're going to talk about healthcare services. On webinar 4, we're going to talk healthcare workers. And then on the 5th webinar, we're going to talk about the community empowerment for this aging society. So as come to the end of this webinar on policy roadmap for healthy aging, I would like to express my sincere appreciation to our 3 panelists for their valuable insights and thoughtful discussions. Today's conversation has reminded us that aging is not only a health issue, it's also an economic, social, family, community, and national development issue. A strong aging policy must connect health, welfare, finance, education, housing, transport, employment, and community support. We have also learned that healthy aging is not just about living longer, it's about maintaining function, independence, oral health, nutrition, social participation, and quality of life. At the same time, the circular economy and care economy show us that aging also brings opportunities for innovations, new services, and stronger recognition of caregivers. The challenge now is to move from policy to implementation. We need integrated services, stronger caregiver support, sustainable financing, age-friendly communities, and better inclusion of oral health in healthy aging programs. So again, thank you to the panelists for joining us today. Thank you to all the participants for your attention and questions. Let us continue this conversation and work together towards a Malaysia where all the adults are empowered, respected, and able to inspire future generation. Thank you everyone. Thank you to the panelists. Thank you to the participants in the chat board who are very active. And thank you everyone. And Assalamualaikum. I hand over this webinar to Firdaus.
Thank you, Doctor. I think just as a word to show slide number 11, we have a national conference coming up in October. Kita alu-alukanlah, we welcome any participation. The last slide on our conference. So we welcome anyone to submit abstracts for presentation, or actually you can participate as participants. Kita amat alu-alukanlah, you can scan the QR code for any further details atau hubungi urus setia. Thank you.
All right, thank you. I hand over the program to Firdaus.
Thank you, Dr. Muhammad Arif. We have come to the end of our second webinar of the Smile 5.0 webinar series. On behalf of the organizing committee, I would like to extend our sincere appreciation to our distinguished panelists, our moderator, and all participants for your valuable time, insightful contribution, and enthusiastic participation. Participants are kindly reminded to complete the participant satisfaction survey via the link provided in the YouTube live chat, and e-cert of participation will be issued upon completion of the survey. We invite all of you to join us for the third webinar tomorrow at the same time via the same streaming platform. Let us watch the teaser video of webinar 3 at the end of this webinar. Thank you once again for being with us today. Wabillahi taufiq wal hidayah. Wassalamualaikum warahmatullahi wabarakatuh.
Hari ini kita berada di Dewan Pusat Khidmat Masyarakat Don Sabak untuk program Community Smile yang akan membawa pelbagai
selamat hidup berseri. Untuk masyarakat bersama harmoni. I untuk ideal, impian di hati. L untuk lancar, senyum setiap hari. I untuk ku ikuti, kasih diberi. Senyumlah selalu, ceria berseri. 20 biji di usia 60 nanti.
And hello everyone. Let us watch some snippets from our community program Smile 5.0 in Sabak Bernam.
So, Assalamualaikum. Bersama kita lagi dalam program Community Smile 5.0 bertempat di Sabak Bernam. So, hari ini kita berada di Dewan Pusat Khidmat Masyarakat Don Sabak untuk program Community Smile yang akan membawa pelbagai aktiviti menarik dan juga information kepada pengunjung lah. So, apa itu Smile? So, Smile adalah satu program komitmen Fakulti Pergigian UiTM dalam membawa ilmu, kepakaran dan perkhidmatan kesihatan lebih dekat kepada masyarakat secara berterusan. So, kenapa kita pilih Sabak Bernam hari ni? So, mengikut statistik kita 2025-2026 Selangor merupakan negeri yang mencatatkan jumlah warga emas tertinggi di Malaysia. So, dan specifically kepada Sabak Bernam mempunyai peratusan warga emas tertinggi dekat negeri ni mengikut nisbah warga emas berbanding jumlah penduduk daerah. So, 21% ke 25% adalah warga emas. Puan Aisyah bawa dengan anak-anak dan
Saya Puan Hafsah.
Puan Hafsah.
Jiran Puan Aisyah.
Oh, jiran Puan Aisyah. Nak tanya sikitlah perasaan. So, kita dah tadi kita dah ada ceramah. Lepas tu sekarang ni kita tengah menunggu untuk demonstrasi masakan sihat oleh Chef Firdaus. So, apa perasaan Puan untuk kita punya program community hari ni lah?
Kita rasa seronok, banggalah boleh dapat sertai sekali dengan ni kan. Itu dekat kawasan kita boleh ada macam ni, alhamdulillah lah. Kita happy lah dengan program-program ni kan.
Bagi saya memang sangat menyeronokkan lah, segala input yang diberikan sangat memberangsangkan. Bagi
Indah crowd, ramai datang ya, penuh dewan tu. Meriah lah, nampak memang meriah dan sambutan cukup baik lah. Saya harap program seperti ni untuk kawasan-kawasan luar bandar macam Sabak Bernam ni cukup bagus lah. Ya, sekurang-kurangnya fokus kepada warga emas terutamanya, banyak yang hadir dan dapat maklumat-maklumat walaupun gigi kita ni kadang-kadang setengah pihak tak berapa ambil kisah. Kalau dah pakai gigi palsu dah kira dah okey, tapi sebenarnya banyak dari segi penjagaan dan penambahan baikan ya untuk keselesaan lah keselamatan hidup.
Did you know that Malaysia is moving towards an aged nation? Older adults may face many challenges such as difficulty travelling to clinics, limited family supports, health problems, and lack of access to regular dental care. Join us in the third webinar Smile 5.0 I am Dr. Nurul Shariza, your moderator for the webinar titled Re-Engineering the System, Improve Service Delivery and Access for an Aging Malaysia on 22nd July 2026 from 9:30 a.m. till 12 p.m. Malaysia time at our YouTube channel at Smile UiTM 450. Let us learn together and be part of the change towards a more elderly-friendly healthcare system. See you at the webinar.
Bila gigi sehat, alhamdulillah semuanya akan berjalan lancar.
Ceria berseri 20 gigi di usia 60 nanti. Untuk kau dan aku bersama harmoni. Smile 5,0 membawa inspirasi. Senyumlah selalu ceria berseri 20 gigi di usia 60 nanti. Untuk kau dan aku bersama harmoni. Smile 5,0 membawa inspirasi. Senyumlah selalu ceria berseri 20 gigi di usia 60 nanti. Untuk kau dan aku bersama harmoni. Smile 5,0 membawa inspirasi. Membawa inspirasi. Senyumlah selalu ceria berseri 20 gigi di usia 60 nanti. Untuk kau dan aku bersama harmoni. Smile 5,0 membawa inspirasi. Senyumlah selalu ceria berseri 20 gigi di usia 60 nanti. Untuk kau dan aku bersama harmoni. Smile 5,0 membawa inspirasi. Senyumlah selalu ceria berseri 20 gigi di usia 60 nanti. Untuk kau dan aku bersama harmoni. Smile 5,0 membawa inspirasi. Membawa inspirasi. Senyumlah selalu ceria berseri 20 gigi di usia 60 nanti. Untuk kau dan aku bersama harmoni. Smile 5,0 membawa inspirasi. Senyumlah selalu ceria berseri 20 gigi di usia 60 nanti. Untuk kau dan aku bersama harmoni. Smile 5,0 membawa inspirasi. Senyumlah selalu ceria berseri 20 gigi di usia 60 nanti. Untuk kau dan aku bersama harmoni. Smile 5,0 membawa inspirasi. Membawa inspirasi. bukan mulut saya. Saya ada mulut, mulut saya sihat. Kalau tidak sihat, bukan mulut saya. Saya ada mulut, mulut saya sihat. Kalau tidak sihat, bukan mulut saya. Saya ada mulut, mulut saya sihat. Kalau tidak sihat, bukan mulut saya. Selamat hidup berseri. M untuk masyarakat bersama harmoni. I untuk ideal, impian di hati. L untuk lancar, senyum setiap hari. I untuk ku ikuti, kasih diberi. Senyumlah selalu, ceria berseri. 20 gigi di usia 60 nanti. Untuk kau dan aku bersama harmoni, semalang generasi wow membawa inspirasi. Untuk selamat hidup berseri. M untuk masyarakat bersama harmoni. I untuk ideal, impian di hati. L untuk lancar, senyum setiap hari.